As warmer weather settles in, the risk of exposure to mosquitoes and ticks increases, bringing with it the potential for diseases that can severely affect both humans and pets. Although the temptation to spend time outdoors is understandable, it's important to recognize that the presence of these pests can present significant health risks. Mosquitoes and ticks can carry dangerous pathogens, including Lyme disease and West Nile virus, and their bite can be the gateway to illnesses that, if left untreated, can lead to long-term health complications or even death. While the warmer months are often a time for hiking, camping, and enjoying nature, they also come with an uptick in the spread of tick and mosquito-borne diseases. As Dr. David Quimby, an infectious disease specialist with Chi Health, explains, it's not just the inconvenience of these pests that should be of concern, but the potential for severe infections. Lyme disease, carried by ticks, can be difficult to diagnose early, and the symptoms, which include rashes, fever, and fatigue, may not show up immediately. By the time the more severe effects of Lyme disease manifest, irreversible damage could already be done. For West Nile virus, which is transmitted by mosquitoes, the risks are equally concerning. Infected individuals can experience symptoms ranging from mild flu-like illness to severe neurological conditions, including encephalitis, which can have long-lasting effects or be fatal. Even though experts like Dr. Quimby assure that there's a window of safety when it comes to Lyme disease, typically a tick needs to be attached for over 24 hours before transmission occurs. This knowledge should not breed complacency. The reality is that many individuals are unaware of the risks until it's too late. A single hike, walk through the woods, or outdoor gathering could expose individuals to ticks and mosquitoes, and they may not realize the potential for infection until symptoms appear, which can sometimes take weeks. Additionally, ticks can often be so small and difficult to detect that by the time they are noticed, the infection might already have been transmitted. Worse, despite widespread recommendations to take preventive measures, like wearing long sleeves, using insect repellent, and checking for ticks, many people fail to take these precautions seriously enough. Some might skip the tick check after a hike, underestimate the importance of using repellent, or think they are safe as long as they avoid particularly high-risk areas. But the truth is that ticks and mosquitoes can be found in a wide variety of environments, not just in dense forests or tall grasses, but even in suburban backyards. This widespread risk only increases the chance of encountering these diseases. Another key concern is the continued underestimation of how quickly illnesses like Lyme disease can progress. Dr. Quimby highlights the importance of recognizing warning signs, such as the distinctive bullseye rash that can appear around a tick bite, or experiencing general malaise, fever, or a rash. Unfortunately, many people do not associate these symptoms with a tick bite, and by the time they do seek medical attention, the infection may have advanced to the point where treatment is more complex or the damage harder to reverse. In some cases, people may not even remember being bitten, as ticks can attach themselves inconspicuously. Additionally, there are troubling issues when it comes to diagnosing these diseases. Lyme disease, in particular, can be misdiagnosed because its early symptoms often resemble those of other illnesses. If medical professionals are not vigilant in considering the possibility of tick-borne diseases, patients may receive the wrong treatment, delaying proper care. This delay can lead to long-term consequences, as Lyme disease, if not treated promptly, can cause persistent symptoms like joint pain, neurological problems, and even heart complications. The danger is that the longer the disease is left untreated, the more difficult it becomes to cure, and the higher the risk of it becoming a chronic condition. Similarly, with mosquito-borne illnesses like West Nile virus, the lack of a vaccine for the disease in the U.S. only compounds the risk. Though most people who are infected with West Nile experience mild symptoms, those who develop severe forms of the disease can suffer from permanent brain damage or death. With no guaranteed protection from a vaccine, the only defense against such diseases is preventative measures. Yet many individuals fail to take these steps seriously. Despite the clear risks, there is still a significant gap in public awareness regarding tick and mosquito-borne diseases. The growing lack of vigilance can be seen in the decline of preventative actions, such as the refusal to wear appropriate clothing, avoid high-risk areas, or use repellents consistently. Many people simply do not take the potential consequences seriously enough, especially when the effects of these diseases may not manifest until much later, by which time it may be too late to reverse the damage done. As the warmer months approach, it is crucial to recognize that these diseases are not to be taken lightly. The longer we wait to take appropriate precautions, the more vulnerable we become to the widespread threat of tick and mosquito-borne illnesses.